All right. Thank you everyone for being here. We will go ahead and just get started first with roll call. So we'll start on Deborah Gross, Nicole Turney, Avery Hart.
Here.
Thank you, Avery. Devin Taliaferro.
Here.
Thank you. Terry Minor Spencer.
Here.
Thank you. Julian McLean. Rachel Shepard.
Here.
Crystal Wamalua. Audra Mitchell.
Here.
Thank you. And then Nicole, I see you just joined. So for your roll call.
I hear.
Thank you. Great. And just before we dive in, Talia is our new GEC commissioner. She's going, well, not commissioner, she's going to be managing the GEC on behalf of the mayor's office. And she has a time commitment to get to. So I just wanted to give her an opportunity to introduce herself before we dive right in. So Talia.
Thanks, Stephanie. Good afternoon, everyone. I'm Talia O'Brien. I'm policy analyst for Mayor O'Connor. I'm very excited to be joining the Gender Equity Commission and looking forward to learning more about the different legislative and policy initiatives that we're driving forward. Just a little bit about myself. I'm a Pittsburgh native. I grew up in Forest Hills. I currently live in Swiss Helm Park. And I'm coming into the mayor's office with about 6 years of local government experience. Spent the first 2 years of my career as a project manager with the Borough of Etna, and spent the last 4 years working in government affairs at the Urban Redevelopment Authority of Pittsburgh. So I'm looking forward to helping drive all of these initiatives forward and getting to learn and meet everyone. Thank you. I also want to take a minute to introduce my colleague, Corey Buckner, the Community Affairs Supervisor for Mayor O'Connor.
Hi, everyone. I apologize. I can't turn on my camera. I'm driving at the moment, but yeah, I manage community affairs, so I work directly with neighborhood-based organizations. But in previous roles, I worked for former Mayor Peduto, and I coordinated his LGBTQIA plus advisory council, which ultimately transitioned into the commission on LGBTQ affairs. So I'll be taking on that role as the staff person, and I know that your work and their work is going to intersect at times, and so me and Talia will be working very closely with each other, and just want to also listen in and hear what you all are working on, and see how I can be helpful to this commission and how you can be helpful to the LGBTQ commission. So thank you for letting me join.
Thank you both.
Welcome.
Thank you.
With that, we can go ahead and dive right in. Hopefully everybody had a chance to read the minutes for the last meeting, but would I be able to get a motion to approve?
A motion to approve the minutes.
Thank you. Second?
I can second.
Okay, thank you. Minutes are approved. We did not have any public comment for this session, so we'll go ahead and move on to reports of special committees. So we did create the survey for internal departments as discussed as part of the 5-year action plan. We were not able to vote on it last meeting just because we didn't have a quorum. So just wanted to bring it back up to you all, see if you had an opportunity to review it. And if so, if we could move to approve that. If not, I'm happy to run through it again.
I kind of forget. Can you tap into it a little bit? Yeah, again, please.
And I'll read it, and I apologize because I cannot share my screen at the moment, but I'll just run through the questions we had formulated. So this was our departmental survey to kind of gather information from departments' existing demographics for either their efforts and or their services, so that we could start identifying disparities. So the name, the department, we have a question: what kinds of services and programming does your department provide to residents? What is the demographic breakdown of residents served by your department? Have you worked to identify any disparities or barriers to being more inclusive and equitable for residents? What would you need to make your services or programs more equitable for residents? And then is there any other data or information you'd like to include that is related to gender equity or would help you to improve gender equity in your department? So think of this as kind of the intro to the beginning of the survey. And then based on these responses, we can follow up with departments more individually, directors and leadership, to dive a little bit deeper.
Yeah.
Stephanie, one note on question 5.
Yeah.
Have you worked to identify any disparities or barriers to being more inclusive and equitable for residents? And this might be something that, like, this is good for this level of survey, and then, as you said, follow up. But I think, if the meat of what we're going to talk about is in the survey, that perhaps revising that to say, have you worked to identify, and what means or methods have you done to fix any of those disparities or so what work has already been started, because they may, since they know their departments so well, there may already be initiatives that they're working on. So that would be one thing that I'd hate to duplicate efforts if some things are already in process.
Okay. Yeah, I like that. Can definitely.
Do you have in there who they are collaborating with?
No, but we can add that as a question.
Yeah.
And I want to say, I think at the last meeting, we had also talked about maybe adding a question of like the demographics and the makeup of like the employees.
Mm-hmm. Okay. Okay, so we can definitely add those questions in as well.
Okay.
And then send that if people are comfortable with that. I mean, we can send this out again just to make sure. But if people are comfortable with that, I think it's a good place to start.
Yeah. I agree.
Yeah, with those updates, I would feel comfortable with that going out.
Okay. I think technically we have to vote on it. So could I?
Okay, I motion to move with the updates.
Okay, thank you, Terry.
I second.
All right, so we will make those tweaks and then send that out on behalf of all of you. Right. Moving on ahead in our agenda. So still kind of paused on the pregnancy loss leave policy and the free menstrual products in city facilities. Just as this transition has been occurring, I've been able to fill Talia in. And Corey, it's great that you're going to be on the leading the LGBTQIA Commission. Something that they also wanted to collaborate with us on was that free menstrual products in city facilities. So I think those will get a little bit more information. But if anybody feels like there's relevant information they want to share just to update Talia and Corey right now, feel free to come up and share.
I think you tapped into basically what we've been working on. I think, or do you want to tap into what the city council was able to accomplish?
Yeah. So yeah, I think if you just wanted to share a little bit about why we're working on this. I know that Adriana was kind of leading it from the beginning point, but if you just wanted to share a bit about why these are your priorities for the commission.
Because for me, they were asked, they asked us to, look into the lack of I don't want to say resources, but supplies in the city's facilities. And so when we did a deep dive, they were correct. And so this is something that is small, small on the radar of something that, that the city asked for. And so, yeah, that's what it was so important to this commission in the committee. And yeah. And then the partnership with PAR and how that looked, moving forward and building, making sure that we're collaborating and building a strong agenda for the city, the city council.
for that summary. That was good.
If I can just add to, at least around the pregnancy loss leave, I mean, that policy is just creating a more inclusive policy that impacts not the non-traditional or what people would consider to be the traditional factors of a leave like that. So just kind of making it more inclusive, naming it so that it can impact, people who maybe have not been considered for that policy to impact before. So I think that one isn't, just equally as important, especially, coming for, the impact that it has on city employees.
To add to what both Terry and Devin said, I think the inclusivity is something that we talked about, especially with the pregnancy loss leave. And I think what we had discussed and we're hoping to accomplish was that would be sort of revised to reproductive care leave, the name of that, so that way it would be inclusive of not just pregnancy loss, but abortion care, all of the things that might need to be taken care of for reproductive health. And I think that, that was, I think, a really important thing for all of us to make sure that we were being inclusive there. And then for the menstrual products, we also had conversations about including safe sex products, which I think would be a great partnership between this commission and the LGBTQIA commission to support not just the employees of the city of Pittsburgh, but also the residents as well in those city-owned facilities.
Yeah, thank you guys for sharing. And Talia, I know you're still kind of absorbing information, so if you have any questions now, or we can come back later as well.
Yeah, thanks everyone for sharing that information. Just one question that immediately came to mind. Terry, I believe you said that did the Gender Equity Commission do a deep dive into looking into city facilities?
We did. The what was the young lady's name before you came on, Stephanie?
Adriana.
Adriana did. She did a so yes, she will have the data on that. Well, or do we have it? It's somewhere in the email probably. But yeah, she did.
Okay, great. Yeah, I would love to take a look at that.
Yeah.
Yeah, I can connect you with Adriana as well. I'm sure she still has the numbers.
Okay, great. Thank you.
Awesome. All right. Moving on then to new business. We have no new business. Do we have any announcements from commissioners?
I do. I had so we had met with, well, first of all, March 21st, there's a young lady out of Pitt University, and they're doing we're doing a defending gender equity and justice in an age of democratic retrenchment. It's Saturday, March 21st. It was a meeting. Well, who they want to meet with is the Black Women's Equity Initiative, CEDAW, with Darlene Mackins, and us, the Gender Equity Committee. And how can we get in the same room and get on the same, because basically it's 4 or 5 different organizations that's doing great work. And instead of recycling, they're basically asking, how can we join together and make it one solid plan for the city instead of various different agendas. And so I wanted to bring that to you all. And then also the Human Rights Coalition have sent an email that they're very concerned. I don't even know if this is on for us, but they're very concerned and wanted the Gender Equity Committee to get involved with the human trafficking and the concern during the draft. And they're very concerned about that, and who has training in recognizing who's being trafficked or anything like that. But they definitely want to talk to I don't know who I should direct them to, Stephanie or to Miss O'Brien, but yeah, that's what the Human Rights Coalition wanted. And or you may have more.
Yeah, I actually
Okay,
have some, I can actually update you a little bit.
great.
On that. PAR is actually working with the county and Pittsburgh Public Safety to develop training for the people who are going to be working at the NFL draft. Exactly as you said, Terry, to be able to recognize and know what to do if they're witnessing human trafficking. We are expecting a huge uptick in that type of activity, both people who are trafficked here locally and then also people bringing in um, trafficked individuals. So we are working with the county. We're working with the city. I will say the the one thing that has sort of slowed down the progress, and this is not a dig on the organization, but the NFL. We've basically been told by the NFL that until after the Super Bowl, they're not going to really transition to their planning in earnest for activities around the NFL draft. So I think we'll have some additional updates from the NFL after this weekend. But PAR has been activated on that, and they're working on some training materials and training programs. However, we would very much be interested in the HRC being a part of that or filling them in on what we're doing and seeing how, so if you want to make that connection to me, I can get the folks at PAR involved and to talk to the correct people on your side.
Awesome. I will email you and I will meet. Well, I'll email out what notes we had and everything to everybody, and then I'll connect you with the Human Rights Coalition contact person.
Wonderful. Thanks, Terry. That would be great.
Absolutely.
Any other announcements folks would like to share?
I didn't have an announcement, but I wanted to say a thank you to the folks on this commission. About 2 weeks ago, City Council did a will of council to support PAR to ask for the state's General Assembly to increase Rape Crisis Center funding across the Commonwealth by $12.5 million. These funds are desperately needed, not just in Pittsburgh, in Allegheny County, but across the state. Unfortunately, the governor's budget that dropped this week does not include any increase. It's flat funded for the 6th year in a row. But we're looking at that as a starting point, and we're going to continue advocating, and the support of the Gender Equity Commission and Pittsburgh City Council will make a big difference for us. So thanks to everyone on this commission who helped make that happen. So thank you.
Absolutely. Yeah, I was happy when I read that email. And that was good. That was good.
Yeah, it really, the staff at PAR, it's a hard job working in that world. And sometimes it can feel like you're the only people who are fighting the good fight. But then when you have people back you up at that level, it really says something. And it was a really good day for the folks at PAR.
Good. We're happy to hear that.
I'm glad we can make that happen.
Yeah.
Any other announcements? All right. I think with that, nothing else on my agenda. So can I have a motion to adjourn?
So moved.
Thank you. Second. All right. Thank you, everyone. Have a good day.